All right, now we're turning to lead exposure and those that might be at an increased risk. The Illinois Department of Public Health has a list of high-risk zip codes. Under state law, any children living in these zip codes have to be tested automatically for lead exposure at 12 and 24 months. All children 6 years and younger are required to be assessed through a pediatrician-administered questionnaire, and any blood tests that come back with certain levels of lead then require a public health intervention. Now, starting July 1st, 148 new zip codes coming from 60 Illinois counties have been added to the high-risk zip code list for this year. That brings the total number of these high-risk zip codes across the state up to nearly 1,200. And locally, the newly added zip codes include some in Carroll, Henry, Joe Davies, Lee, Ogle, Rock Island, and Whiteside counties. Now, joining us now to talk about all of this is the director of the Illinois Department of Public Health, Dr. Samir Vora. Dr. Vora, thank you so much for being here with us today.
Well, Shelby, thanks so much for having me.
Now, I understand that within the next 2 years, by 2026, the department wants universal testing for lead exposure across the entire state, but for the time being, how do you determine which zip codes to add to this list?
Well, Shelby, first of all, what we know from increasing research and clinical care is that there really is no safe lead level. And what pockets of lead exposure can cause, especially for young children, are developmental concerns, often sometimes leading learning difficulties. And that's why it's been a real goal of the Illinois Department of Public Health to get to a place of universal testing. At the moment, as we scale up to that, we want to make sure that we have the right resources and partnerships with local health departments. And the highest risk areas at the moment are those that have most exposure to lead-based paint, really houses that were built before 1978, which was the moment in time where we outlawed lead paint. And then also other risk factors. And so we have grouped all of the zip codes across the state into those different levels based on those risk factors. And we plan to broaden those zip codes each year until we get to universal testing in 2026.
So do you have any numbers for how often blood tests around the Quad Cities come back with these excess levels of lead?
Well, we know that in many of the areas around the Quad Cities, there's an average about 2 to 3% of these blood tests that have that kind of cutoff level for that public health intervention that you mentioned, in a level over 5. Rock Island, Whiteside County, Mercer County, they're all around 2%. Henry County, a little bit higher, with 3% of the tests that are drawn have that level over 5 that leads to a public health intervention.
Okay, so if a parent searches for their zip code, they find it on the list, what steps should they take next?
Well, it's really important for all families to be aware of the zip codes that they live in, but it really is a place where for all well child visits in the years 1 and 2 as a general pediatrician myself, I would routinely have these conversations with my families. And as you mentioned, it is Illinois law that all individuals at those high-risk zip codes should have a lab test drawn at 12 to 24 months to check those lead levels. But primary care providers, family docs, pediatricians, nurse practitioners also routinely provide a questionnaire where they ask individuals questions that might give us and give the provider some more information around those risk factors. If any of those questions are either a yes or an I don't know, most providers do those blood tests just to be sure. But we're always helped by families to ask really good questions to providers, and that's why we're here to talk to your listeners so that they're aware and can make sure that they have those conversations with their primary care provider.
So before I let you go, is there any sort of funding for low-income families to complete these tests, especially those for children at 12 and 24 months?
Well, the good news is that blood lead level testing is covered by Medicaid and most insurance providers. And also, there are partnerships between federally qualified health centers, most commercial labs, to make sure that people that are uninsured or underinsured have access, including those partnerships with your local health departments. And so that's a good conversation to have with your provider or your local health department to make sure that you're covered. And Illinois is fortunate to have partnerships with the federal government and other entities, including those local health departments, to make sure that those public health interventions are covered. And if anybody has a level higher than 5, that we have a public health individual come in. We work to find out where that lead is coming from and making sure that we're doing the proper education to families so that they can decrease their exposure to any of the lead that might be in their surrounding areas.
Well, Dr. Bora, I appreciate your time. Thank you so much for joining us here today.
Well, thanks so much for having me.
And hey, if you guys want to check out to see if your zip code is on this list, we will have everything linked on our website around the time that News 8 at 5 goes on air. All you have to do is go to WQAD.com and click on the As Seen on TV tab.